Okay. So, if I can get this. Okay. So I'm talking about the accreditation of healthcare organizations by Tyrell Miller. What is accreditation? Accreditation is the process that faculties go through to demonstrate that the quality of healthcare they provide meet the highest standards of the industry. Accreditation began with the joint efforts of the American Hospital Association and the American College of Surgeons and their desire to improve the quality of care provided in hospitals. Those two entities joined to form the Joint Commission on Accreditation of Hospitals, the first accrediting body for healthcare, and is considered the gold standard of the accreditation in the healthcare industry. And so, as I said, it's pretty much it pretty much shows for a healthcare organization that they're striving for the gold standard. They have a desire to do better than the basic standards required for a healthcare organization. And also it started with the American Hospital Association and the American College of Surgeons, and they combine, and that's why it's called the Joint Commission. One of the most commonly accrediting body we have in America, and that's where it originated from. Accreditation. So accreditation shows an organization's desire to improve their healthcare providing quality and skills, and it allows an organizations to either rise to a higher level of quality healthcare compared to other organizations and or reach a gold standard. So accreditation, like I said, is kind of something that just shows to patients that the healthcare organization is striving to be better than the basic standards, and they're striving to be better than maybe what other healthcare organizations are. They want to provide better health. They want better quality healthcare. They want to have better skills than others. That's what they're striving for. The gold standard. Is it mandatory or voluntary? So accreditation is a voluntary process and is for the benefit of the organization. Accreditation allows healthcare organizations to demonstrate a higher level of performance and patient care, but is not required by any governmental organization to allow a healthcare industry to provide services. So that's pretty simple. It's a voluntary process, and it's for the organization. It's not it's not like the government is requiring them to do all these extra things to be better. The government requires the basic standards, but organizations realize that these are just basic. They want to be better. They want to improve. They want to be the best they can be to provide the best health that they can be. And that helps with when people are thinking about which doctor, which healthcare organization they should go to. That, of course, they're going to want to go to the one that's is accredited compared to the one that's not. It just tries to stay above that fulfills the standards required instead of going up and beyond. But there's no government organization. There's no governmental organization that requires organizations to be accredited. So then we go on to the board certification for physicians. Board certification is a medical specialty certification that allows a physician to demonstrate his or her exceptional expertise in a particular specialty and or subspecialty of medical practice. Medical specialty certification in the United States is a voluntary process similar to accreditation. While not required, has become increasingly more important to employers. It is awarded by the American Board of Medical Specialties. And then this is American Board of Medical Specialties says this: the Gold Star signals a board certified physician's commitment and expertise in consistently achieving superior clinical outcomes in a responsive patient-focused setting. Patients, physicians, healthcare providers, insurers, quality organizations look for the Gold Star as a measure of a physician's knowledge, experience, and skills provided. And so, it kind of goes along with accreditation. We're going to talk about that next, but it's, you know, it's a certification that a physician can receive in order to show that he's similarly going up and beyond the basic requirements. You look at people with that just, you know, get their license. And I was thinking about it when I was doing this. I was thinking about, you know, maybe not everybody is fully informed about board certification, knowing that it is not required, that it is just, you know, it's a voluntary process. But, you know, students in this class, now that they know what it is, if you were asked, like, would you rather go to someone that, you know, this doctor that's licensed or this doctor that's licensed and has a board certification, you know, everybody, 99% of people are going to tell you they'd rather go to the person that's board certified, just because it shows that they're striving to provide, you know, higher quality healthcare. They're striving to, you know, work on their skills and become the best that they can possibly be. And it's nice knowing that they're doing more than just the basics. They're trying to learn more, trying to be better at what they do. So I'm going to talk about the process of board certification, because this was kind of interesting to me how this comes about, how they get this certification. And so, of course, you finish your 4 years of pre-medical education, your bachelor's degree. Then you go into medical school, you get your medical degree from a qualified medical school, followed by your 3 to 5 year full-time experience in a residency training program. And then you provide letters of attestation from the program and director of faculty, followed by obtain an unrestricted medical license to practice medicine in the U.S. And then you have to pass a written or oral exam created and administered by the ABMS member board. And so it's kind of, you know, it kind of makes sense why most people would be board certified, because they're already doing, you know, most of those things. That is, they're already getting their bachelor's degree, they're already going to medical school, they already have to go to residency, like they already have to do these things in order to get their medical license. How much more is, you know, a written and oral exam? Yeah, they might be expensive and cost more, but it's, you know, in the long run, it's worth it, knowing that that you can show employers that you're striving to become better and you're striving to, you know, provide better healthcare. So accreditation versus the board certification. Both accreditation and board certification are the gold standard for quality care. That's what the organizations that accredit accredit and give board certification, they say they're the gold standard. They show the organizations and the physicians, it's their way of showing that they're trying to do better. They're trying to go above the basic standards that are required for a license. They give standards that test performance and skill, and it's a voluntary process. As I said, it's both accreditation and board certification are both for the physician and for the healthcare organization. There's no governmental body that makes sure that they have either one of these. And then lastly, both are highly encouraged in the field of healthcare. And this makes sense because, like, as I said, most people that understand what a board certification is are most likely almost always going to go to the physician who's board certified, compared to, you know, the normal physician that just has this license. Like, it's more important. And so as an employer, of course, you're going to look for someone that is going to, you know, improve their healthcare organization and provide the best healthcare that they can. So the role of ISO. ISO stands for the International Organization for Standardization and is the world's largest developer of voluntary international standards. ISO represents an international consensus on good quality management practices. Through its members, it brings together experts who share knowledge and develop the voluntary consensus-based, market-relevant international standards that support innovation and provide solutions to global challenges. ISO international standards give state-of-the-art specifications for products, services, and good practice, help to make industry more efficient and effective. developed through global consensus. They help break down barriers to international trade. And so one of the last questions is to understand why the Rexburg Memorial Hospital uses ISO. And I called and I didn't really get the best answer that I was looking for. I'm not sure if I was talking to the right person. I thought I was, but I just didn't really, I don't know, it just didn't really make sense what they were saying. And so I decided to do a little bit more research on my own and came across this. This is from the Pulse. It's the Rexburg Madison Memorial blog that they do. And this is what it says. Some people have asked why we opt to be accredited by DNV versus another accreditation body like the Joint Commission. DNV is just their, another accrediting body. There are 4 accreditation bodies that have been approved by Medicare to survey hospitals. So why DNV? It comes down to philosophy. In May 2001, we became the 13th hospital in the United States to become certified to the ISO 9001-2008 standards, and the DNV has built their surveying process off the ISO standard. ISO is not an accreditation, it is a certification. ISO is all about continual improvement, and that is what we want our accreditation body helping us do. We recognize accreditation as a team effort and welcome the surveyors to help us identify noteworthy efforts, areas for improvement, and even correction actions. Evaluating each of these will advance our organization from a good to a great. And that, that helped me understand a lot better. It's, it's pretty simple. They believe the ISO is all about, continual improvement. And of course they want an accrediting body that, strives to provide better health care to, make their hospital better. And they, like in the last, it will advance their organization from good to great. So they see that ISO would be the most helpful, unless there's other factors such as costs and stuff. But what they say and what they want to tell their the citizens is that it's because they see as the most helpful accrediting body they know. And it'll help them advance more with ISO compared to, other accrediting bodies. I also found this was also interesting. This is from the, just their website, the About Us page. And it says, Madison Memorial has grown substantially over the years, but has never lost the enduring goal of fulfilling the emotion, physical, and spiritual needs of those we serve. The organization has earned the ISO 9001, 2000, or deemed status. This is the most sought after recognition for quality outcome management by international healthcare organizations. And so just pretty similar. This is also, this is the other factor is they believe it's the most sought after, well, it is the most sought after recognition for international healthcare organizations. And they understand that it's the gold standard and it's something that they want their hospital to have to show their patients that they are striving for, they're striving to improve the quality of care that they provide their patients. And that is the accreditation of healthcare organizations. So, thank you.